Absolutely. Absolutely. So you have this experience with your mother and your father as to being a caregiver. You do make it through college into young adulthood. At what point in time did you start to learn about genetics and the risk factors associated with hereditary cancer, and what led you to getting tested?
So, great question. And I will say this, and I didn't share. My mother was not asked about her family health history, nor was she offered genetic testing. Now,
Right.
mind you, that was 2003. So, that's not, it's the conversation is not as mainstream as it is today, but it was available, right? And she should have been talked to. She should have been asked about. We know that there's disparities in the communication of genetic testing from provider to patient, especially in Black women, right? And so she was not asked about her family health history. She was not asked about genetic testing. And so that was a huge eye opener, right? And so when my mother was diagnosed and my father was diagnosed, I was just entering my early career as a health and PE teacher. So, health was something that was really important to me. I received my degree in community health when I graduated undergrad. And Rome was scared because I literally just saw what was happening to my family. And I knew I didn't want to be next. And so it was the family aspect, right? But then it was also the provider aspect. I had a phenomenal OBGYN who's now retired, who always amplified and elevated the importance of family health history early on. So it has been something that was embedded in me from seeing my doctor annually. And she always told me if your family health history changes, because we know family health history can change at any time, and or if you find out new information, right? Because you could go to the family reunion and find out new family history. So she told me if anything changed or if you find out new information, call me immediately. Do not wait for your annual. And so that had always been instilled in me when I went to her offices. And so that's what I did. Um, After my mother passed, of course, going through the grief process and then my dad being diagnosed, I just had just some time to process. And I was like, I need to call my doctor. And so I reached out to my OBGYN. She brought me in, and that's when she talked to me about genetic testing, well, genetic counseling and genetic testing. And so I was, again, a young adult, like, what is this? What does all of this mean? And so I was very fortunate and blessed to be able to go through pre counseling and post counseling. And I know that's very rare, right? And so went through pre counseling. The genetic counselor really just explained to me what I was about to embark on, what this test was about. And then I went through testing. I found out, of course, I carried the BRCA2 mutation. And then I went through post counseling, which really helped me to know like my next steps. And while they didn't really push, a medical management on me, it was just, these are options, and, you can continue the conversation with your OBGYN. And so that's what I did. And that's when my OBGYN connected me with my high risk oncologist. And from there, life looked different.
I just want to pause there and just contrast the different provider experiences. And here on Genetics with Healthcare, we our mission is really to reach patients and their caregivers to close the gap between innovation that is amazing and that can save lives, prevent disease, and getting access to those things that can save lives and prevent disease. While your mother's experience with her provider, and this is no passing judgment, this is just saying what is here. In that instance, bracket testing had been out for about 7 years at that time. But in this instance, the provider didn't, as you mentioned, didn't even ask for your mother's family history. That sounds pretty basic. This is stuff that you fill out on your paper when your intake paper to try to put in your chart. Okay, it's one thing for it to
Hmm.
be in the chart. It's another thing for somebody to act on it. But also, again, not passing judgment, but for whatever reason, that physician didn't mention bracket testing at that time versus the experience that you had with your doctor, very engaged, seemed to be in in it with you for your health care to say, hey, let's be proactive. Let's keep the conversation open. You don't have to schedule an appointment. Call me because we want to do something. Just two different experiences from a provider. And again, this is not a medical advice show, but we share stories of patients and advocates like yourself to help people understand, find a doctor that is willing to do what you want for your health, to ask you the questions. And we want to be able to give them the language and the confidence to go ask questions and engage their providers like that.